Test materials for the Goldman-Fristoe Test of Articulation 2 includes an easel textbook. This includes picture plates and can be self-standing. This helps the clinician present the pictures and give the suggested cues. The material is presented by showing the picture and pointing to a specific part of it. For example, the clinician would point to the picture of the telephone and ask, "What is this?" The manual gives rationale and test development history. It also provides information on how to administer and record each response for each section of the test. Data regarding norms, reliability, and validity are also included in the manual. A supplemental developmental norms booklet is also part of the testing materials. Its purpose is for the clinician to compare their client's results to the norms tested and determine the client's developmental age in regards to articulation. The booklet is used by clinicians to determine if the client qualifies for services. Lastly, included in the testing materials for this test are the 25 response forms. These forms are used by the clinician to record testing results. The form can then be used in the future to compare to a second test form to see if the client has made any progress. The response form has a section for recording identifying information about the client. The score sheet is divided into the 3 different sections of the Goldman-Fristoe Test of Articulation 2: sounds in words, sounds in sentences, and stimulability. Each of the sections includes a separate recording grid with shaded columns of blue, yellow, and green for initial, medial, and final sound production. Each row of these grids corresponds to one of the 39 consonant sounds or consonant clusters tested in the Goldman-Fristoe Test of Articulation 2. Scoring the test. The test is scored by determining the raw score from sounds and words. The total number of articulation errors, marked by an X, are counted. The raw score is recorded in the sounds and words score summary section. The raw score is then used to find the standard score, confidence interval, percentile, and test age equivalents. The referral. Mary Grace Forte is a 7-year, 10-month-old girl who was referred for an evaluation by her 3rd grade teacher, Miss O'Connell. Her teacher has some concerns regarding her articulation. The interview. The interview is an important part of diagnostics. Here, a clinician can get information, give information, and provide support for the client and their caregiver.
Did anyone else notice any speech difference? Did you ever before the referral by the teacher?
I've heard her pronounce some sounds incorrectly, and she has difficulty producing some sounds, but it's really, I've just noticed. And her teacher has noticed, obviously, because she was the one who referred her.
Okay, does anyone else in the family have any problems producing sounds, or is it just
No,
Mary Grace?
Just her.
Okay, I noticed in your case history form that you marked down that she didn't imitate sounds by 12 months. Do you remember when she started imitating the sounds?
I would say about 6 months later.
Okay, so around 18 months.
Yeah.
Okay. Does she get frustrated at school? Has the teacher told you anything like that teachers or students can't understand?
No, no one's ever told me, the teacher, she's never come to me saying she has a problem with other students.
Okay, so I'm just going to start off the exam by giving Mary Grace an oral peripheral mechanism examination, which is just going to look inside of her mouth,
Okay.
outside, look at her symmetry to see if everything's okay, if that's the cause
Okay.
of if she does have an articulation problem. And then afterwards we'll start the articulation test and we'll score and I'll let you know
Okay,
what
thank
the
you.
problem is.
The oral peripheral examination is an important component of a complete speech assessment. The purpose of the oral peripheral examination is to identify and rule out structural or functional factors that relate to a communication disorder. We begin by observing the symmetry of the face and the appearance and mobility of facial parts, like the lips, jaw, and tongue are noted.
Okay, so I want you to pretend to be a fish. I want you to hold all the air inside of your mouth like this for as long as you can.
Okay.
And while you're doing it, I'm just going to push on either side of your cheeks and you hold in the air as long as you can, okay?
Okay.
Ready, set, go. Very good. So when you give me just a small smile and showing no teeth.
Okay.
Very good. Give me a big smile, like you're really, really happy, like it's your birthday. Good job. So now I want you to pucker your lips like this. Very good. Okay, now I want you to open wide. I'm going to stick this light into your mouth and just look inside, okay? Good job. Now I want you to say, ah, and I'm going to still shine the light inside of your mouth. Good job. Now I want you to say ah for as long as you can. Ready, set, go. Stick your tongue out a little bit for me while you do that. Very nice. Good job. So now I'm going to take the same tongue depressor like before, and I want you to stick your tongue out. Stick it out. Can you do it a little further for me? Can you touch the stick? Good job. Now I want you to push the stick as far as you can right in front of your mouth. A little harder. Good job. Now I want you to be able to push the stick to the side. So I want you to touch. Good job. And touch on this side. Very good. So now we're going to you're going to copy the sounds that I make, and then we're going to put all the sounds together. So I want you to start by saying pa 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 pa.
Pa 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 pa.
Next is ta 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 ta.
Ta 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 ta.
Next is ka 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 ka.
Ka 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 ka.
Now we're going to put the sounds together like this, pataka, and I want you to say that as many times as you can in a row. So pataka, pataka, pataka.
Pataka, 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 pataka.
Very good.
Any abnormalities of the articulators of the speech mechanism can be the cause of an articulation problem. Prior to the GIFTA-2 assessment, the clinician should read the manual thoroughly and become familiar with the directions of each test with the GIFTA-2. The test should be given in a quiet, well-lit room with a table and at least 2 chairs. The self-standing easel should sit on the table with pictures facing the child's chair. The response form should be placed behind the easel on the tester side of the table. Demonstration of sounds and words.
Hey, Mary Grace.
The easel should be turned to the first tabbed page, which is blank. The clinician will then read the specific instructions to the examinee in a natural conversational style before the first picture plate is shown.
Are you ready?
Once the clinician is finished reading the directions, she will turn to the first plate and point to the picture and then ask, "What is this?"
What is this?
Tree.
What's this in the house?
Window.
Very good. What do you call this?
Telephone.
Good job. What's this?
Cup.
What's this?
Knife.
And what's this?
Spoon.
Very good job, Mary Grace. She is not a boy, she's a...
Girl.
And what is this that she's playing with?
Ball.
What is this?
Toy.
Maybe you could pull toys in it, but what do you call that?
Wagon.
Good job. And what's next to the wagon?
Shovel.
Very good. And what's this?
Monkey.
Good job. And what's the monkey holding?
Banana.
Can you say that for me one more time?
Banana.
Good job. What's this called?
Zipper.
And what are these?
Scissor.
Can you say it one more time?
Scissor.
What's this?
Duck.
And what does the duck say?
Quack.
And what color is the duck?
Yellow.
What do you call this?
Vacuum.
What is this?
Watch.
What do you call this?
Plane.
Say it for me one more time.
Plane.
What is the girl doing?
Swimming. I like to swim too.
You do? Can you swim in the deep end?
Mm-hmm.
What's your favorite stroke?
On my front.
You like the what?
On my front.
On your front? Okay. What are these three things?
Watching.
Good job. What's this?
Yamp.
Say it for me one more time.
Yamp.
What's this?
Caw.
And what color is it?
Blue.
What is this?
Rabbit.
And what's this?
Carrot.
What color is the carrot?
Orange.
Good job. What is the boy doing in the picture?
Fishing.
Have you ever gone fishing before?
Mm-hmm.
Who do you go with?
My dad.
That's nice. I don't really like to fish. What's this?
Chair.
Say it for me one more time.
Chair.
This fell off the bird. What do you call this?
Feather.
What are these two things?
Pencil.
Tell me which one is bigger. Good job. What's this?
Bathroom.
Well, it's in the bathroom, but what is it called?
Bathtub.
Good job. When he gets dirty, he takes a.
Bath.
Do you like bath time?
Mm-hmm.
What's this?
Ring.
Okay, and what's this?
Hand.
Well, it's a part of the hand.
Oh, finger.
Good job. And which finger is this?
Thumb.
Can you say it for me one more time?
Thumb.
Okay. And what's the horse doing in the picture?
Yumping.
Okay, he's jumping. What is the little boy wearing to bed?
Pajamas.
And what are these?
Flowers.
And what do you call this?
Brush.
And what's this?
Drum.
Very good job. And what do you call this?
Frog.
And what color is it?
Green.
Good job. What do you call this?
Clown.
And what are these that he's holding?
Bones.
Can you say it for me one more time?
Bones.
Oh, what's the little boy doing?
Crying.
What are these?
Glasses.
And what's this?
Slide.
And what are these?
Stars.
And how many are there?
5.
Very good. Okay, so we ended that part of the test, and then we'll start sounds and sentences.
Demonstration of sounds in sentences. The clinician will read the instructions at the bottom of the tabbed page to the examinee. The clinician has to make sure the examinee understands that he or she will have to retell the story once they are finished. The clinician will begin reading the story, pointing to the target words as instructed.
So Jack and Rachel are going fishing. Rachel's in such a rush that she drops her glasses,
Oh yeah, I see 'em.
and her shirt gets caught in the zipper of her jacket. They fish from the old bridge. All of a sudden they hear a very loud noise. Oh, it's only the dog chasing a frog. Do you know what sound a frog makes?
Bennett.
Very good. So Jack and Rachel catch 13 fish. That's a lot of fish. So we're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. They laugh because they are very, very happy. They go back to Jack's house. Jack's mother cooks the fish that they caught. Okay.
After the clinician finishes reading the story, they must turn back to the first picture and ask the client to retell the
So now I'm
story.
going to have you retell me the story. I'm going to show you the pictures like we did last time.
Okay.
Okay.
So what do you remember? Do you remember their names? The boy and the girl?
Jack and Rachel.
Very good. And what were they doing?
They're going on a fishing trip, and she lost her glasses
Can you point to me where she lost her glasses?
on the grass.
Very good. Do you remember anything else that happened?
They brought their dog, and she was in a hurry and got her shirt caught.
Good job. If target words are not being used, the clinician should try to elicit them by asking questions about the picture or pointing to specific details rather than supply the words for imitation. So what's going on here?
They fished on the bridge, and their dog chased a frog.
Do you remember what sound the frog makes?
And it,
Okay. Wow, that's a lot of fish. Do you remember how many fish it was?
it was
Can you count out loud for me and point?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 fish.
13? Very good. And where did they go now?
To Jack's mom. She cooked it.
She cooked what?
She cooked the fish.
Demonstration of stimulability. Stimulability can be administered after either sounds in words or sounds in sentences. Stimulability is used to determine the relative ease in which the examinee can correctly produce previously misarticulated sounds in a situation that gives them every advantage of visual and auditory modeling. When administering the stimulability material, the clinician is only to test the sounds misarticulated during sounds in words or sounds in sentences. They are only to test the sounds in the position in which the error occurred.
Wet. You see how my lips go out like that? Wet.
Wet.
Good job. Now wet.
Wet.
He has wet feet.
He has wet feet.
Very good. So next we're going to move on to the R sound. And we're going to say ra,
Ra.
ra,
Ra.
ran,
Ran.
thaw,
Thaw.
thaw,
Thaw.
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 Good job.
Testing of each error sound starts at the syllable level, and with success will progress to the word and sentence level of complexity. If the examinee succeeds in imitating the syllable, go on to the word imitation. If the examinee succeeds in imitating the word, go on to the sentence imitation.
Lie,
Lie.
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 Bring your tongue here. Lie.
Lie.
Like.
Like.
Very good.
The recording of notations of errors differs between the levels of articulation that are being evaluated. For Level 1 testing, presence of error, the clinician must record each notation in the corresponding cell for that particular sound and its placement of production. If the sound is produced correctly, the cell can be left blank or marked with a check. If the sound is produced in error, an X is marked in the cell. If the sound is not produced, a diagonal line is put in the corresponding cell. For Level 2 testing, presence and type of error, the clinician would have to mark the cell with IPA symbols for substitutions, omissions, distortion, and addition.